Hello everyone, welcome back to another interesting video from Nurses, the Heart of Healthcare. Keep learning, keep growing. My name is Shanaz, and with Shanaz, develop a passion of learning and keep growing in the field of medicine. Here I came up again today with another interesting topic from ENT, okay, that is ear, nose and throat. And in this video, we are going to discuss one very interesting topic that is one of the inner ear disorder known as BPPV, okay, that is which stands for Benign Paroxysmal Positional Vertigo, okay, the most common cause of vertigo. BPPV is nothing but it is a vestibular disorder that affects the inner ear by disturbing the tiny crystals that help to maintain the equilibrium. Okay, usually we receive these kind of cases in ER which may be confused with stroke, but they are actually, after examination they realize that it is BPPV. Yes, okay. So to know further details of BPPV and to understand it better, stay connected with Nurses, the Heart of Healthcare. And before moving ahead, a small and gentle reminder to all my lovely viewers that if you are new to my channel, please subscribe my channel, and if you find the content helpful, please do like and share my videos. Okay, so BPPV, as I said, it is one of the most common cause of vertigo. That is a sudden sensation that you are spinning or the inside of your head is spinning. BPPV causes episodes of dizziness and a sensation of spinning with certain head movements. It causes episodes of mild to intense dizziness, okay, and they are commonly triggered by some specific changes in the head's position. Okay, this might occur when your head is up or down, or when you lie down, or when you turn over, or when you sit up in the bed. Okay, with certain changes in the movement of your head, these episodes of dizziness are triggered. Okay, so BPPV actually, it is not it can be a bothersome problem, but it is not a very serious problem or a life threatening condition. It is not a life threatening condition, but the main problem why it is bothersome is it increases the risk of fall. It increases the patient's risk of fall. See, if they have dizziness, they may fall. Okay, and when they fall, they may get a head injury or some other injury. Okay, so that is one problem with the BPPV, but otherwise it is not a life threatening condition. Okay, so let's understand more about it. Now see, this is benign paroxysmal positional vertigo. This is our ear. Yes, this is our external ear, the outer ear. This is our middle ear, from here to here, yeah, from the ear pinna to here, and this is our middle ear, and this is our inner ear, the circle part. This is our inner ear. Yes, okay, so, and this vestibular system. Okay, this vestibular system, as you can see over here, yeah, this one plays a main role in causing BPPV, that is benign paroxysmal positional vertigo. Okay, so what happens in BPPV, how it occurs, let's understand it. So what happens in BPPV is, see, in our inner ear, okay, it's a common disorder. Okay, in our inner ear there is a system called vestibular system here. Okay, and here there are some tiny calcium carbonate crystals present, okay, naturally, and they are known as otoconia or canalith. Okay, they are also known as otoconia or canalith, these small tiny calcium carbonate crystals. Okay, and these semicircular canals, they are also filled with the fluid. Okay, so the original place where these tiny crystals belong is atricle. Okay, so that is their natural place where they are supposed to be, but sometimes what happens is they are dislocated. So BPPV occurs when these crystals called otoconia, okay, these crystals which are called otoconia or canalith, which are normally located in one part of the vestibular system, that is atricle of the inner ear, they become dislodged and they get collected in the another part of the inner ear. Okay, so the balance system is disturbed. Okay, from one semicircular canal to the other one, the balance system is disturbed. So what happens when these crystals get dislodged? When these crystals get dislodged, what happens is when the head moves, okay, these dislodged crystals also moves. Okay, and they send incorrect messages to the brain, okay, regarding the head movement, okay, regarding and also from the brain and to your eyes. Okay, so the brain receives the messages that the head is moving, although the head has only moved a little, okay, the head is moving, so it gives confusing messages to the brain, and this will cause the symptoms such as an illusion of movement or spinning with some common movements or changes in the position, okay, and like rolling over when you roll over in the bed, or when you're getting up or getting out of the bed, or when you're working to reach out something, that time it sends confusing message to the brain and you may have the episodes of dizziness. Okay, I think here in this pic you can see very clearly. See, these are the tiny, which I said, the tiny calcium carbonate crystals, which are known as otoconia or canalith, which originally belong to this place. Okay, that is a trickle. Okay, so what happens because of some cause that we are going to discuss in a minute, they get dislodged from their original place and they get into the semicircular canals. And these semicircular canals are actually filled with the fluid, and as the head moves, okay, so see these series of canals, they are filled with the fluid, and these canals are oriented at different angles, and when the head is moved, the rolling fluid inside these canals, they send messages to the brain regarding how far and how fast and in what direction the head is moving. Okay, so what happens when these crystals, they get dislodged from their original place and they get into these semicircular canals, they send confusing message to the brain regarding the head movement. Okay, and the person will have the episodes of dizziness. So this is the pathophysiology, I mean what exactly is happening in BPPV inside our inner ear. Okay, so now coming to the causes of BPPV, the exact cause of BPPV is not known. Okay, often it is unknown, so it is called as idiopathic BPPV. Okay, in large number of cases the exact cause is not known, and in those cases where the cause is known, it is mostly associated with minor or severe blow on your head. Okay, that means minor or severe head injury. Okay, and it can occur because of the disorders that damage your inner ear. Okay, and it can also occur because of the damage that occurs during the ear surgery. Okay, if the patient has undergone some ear surgery and some damage occurred during the surgery, and in those people who sit for a long period of time on their back during the dental procedures. Okay, and it is also associated with migraine, head injury, and degeneration of the vestibular system in the inner ear due to aging. Okay, and these are some of the causes of BPPV. Now coming to the signs and symptoms of BPPV. The signs and symptoms of BPPV, as you can see over here, is the first and foremost is dizziness. Okay, a false sensation that you are spinning, or the things around you are spinning, or the inside of your head is spinning. Okay, a sense that you or your surroundings are spinning or moving. Okay, and a loss of balance or steadiness. Okay, and nausea, vomiting. Okay, and nystagmus, that is the abnormal rhythmic movements of the eye. Okay, and then loss of balance will be there, slurred vision will be there, nystagmus will be there. Okay, and the symptoms are like, they commonly come and go. Some symptoms are intermittent. Symptoms are usually intermittent, stopping for several weeks or months, and then they restart again. Okay, so this usually happens in BPPV. Then next, coming to the risk factors, who are more susceptible of getting BPPV, those at any age. Okay, BPPV actually can occur at any age, but it is very common in people over the age of 50 or older. Okay, and it is more common in women than in men, and in those patients who have a history of head injury, or those who underwent any ear surgeries, or any problem with the balancing system of the inner ear. Okay, and the common triggers include the rolling over in the bed or getting out of the bed, and lifting your head to look up. Okay, so with this head positions, the episodes of dizziness are triggered. Okay, so these are the common triggering factors. Now coming to how the diagnosis is made. Diagnosis is made by history collection. Okay, based on the signs and symptoms. Okay, the patients are usually asked questions, okay, regarding their signs and symptoms, and then some of the tests are done. Okay, based on that, diagnosis is made, and after that, coming to the treatment, BPPV can be treated with some simple exercises. Okay, and the most common exercise that is used to treat BPPV is Epley manure. Okay, so we will discuss Epley manure in detail in the next video. Okay, I'll show you how it is done. So Epley manure is the most simple and non-invasive and non-expensive approach to treat BPPV. Okay, and other simple exercises which are taught by the physiotherapist and expert medical professionals to manage with the symptoms of BPPV. Okay, so it is usually treated using a range of positional maneuvers that aim to move the crystals out of the semicircular canal of the inner ear and move to its original place. Okay, and those patients who come to ER with all the symptoms and being confused as stroke, okay, then later they are diagnosed as BPPV, then they will be given injection Stemetil, and physiotherapist will be informed. He or she will come and do the Epley manure, and also they will demonstrate them the exercises that they are supposed to do, okay, to help them relieve the symptoms, because see, exercises play a major role. They will help to enhance the balance. Yes, as you can see here, exercises will help them to enhance the balance, to relieve the symptoms, and also what we say, to improve their postural control. Okay, and they prevent the reoccurrence of this BPPV episode again. Okay, so exercises play a great role here. So it's simple. Epley manure is done. I'll show you Epley manure in the next video. Okay, so now in short, what is BPPV? All that we have learned: BPPV, which stands for benign paroxysmal positional vertigo. Benign because it does not cause further illness. Yes, paroxysmal because it is temporary and sudden onset. Positional because it is related to changes in the body position, and vertigo because it causes false sensation of spinning. Okay, so this is what exactly it means. Okay, so BPPV is a very common ear disorder. Hope this video has helped you in understanding. Now, thought for today is always keep your heart pure and intention clean. So whatever happens ahead, you will never lose the people. People will lose you. Okay, so, and as I always say, try to help others in whatever way possible and how much ever you can, and stay connected with Nurses, the Heart of Healthcare. And please do like and share my videos. Thank you so much for watching. Hope the content was helpful to you in understanding BPPV. Thank you.